You're sitting in your doctor's office. They just prescribed you a medication for nerve pain. But you've heard there's another similar drug that might work better. You're confused. You're wondering which one is right for you. Today, we're breaking down Gabapentin versus Pregabalin. 9 key differences that could change everything. Stay with me because difference number 5 might surprise you. Let's get straight to the point. Gabapentin and Pregabalin are both nerve pain medications. They belong to the same drug family. They work in similar ways in your brain. But here's the thing. They're not identical twins. They're more like cousins. And those differences matter. They matter for how fast they work. They matter for how well they work. And they matter for your wallet. By the end of this video, you'll understand exactly what sets these two medications apart. You'll know which situations favor one over the other, and you'll be ready to have a real conversation with your doctor. Let's dive in. Difference. Number 1, absorption rate. Let's start with speed. How fast does each drug get into your system? Pregabalin is the sprinter here. It reaches peak levels in your blood in just 1 hour. Gabapentin? It's more of a marathon runner. It takes 3 to 4 hours to reach peak levels. Now, why does this matter? If you're dealing with breakthrough pain or a flare-up, Pregabalin kicks in faster. You feel relief sooner. Gabapentin takes its time. This doesn't make it bad. It just means you need to plan differently. If quick relief is your priority, Pregabalin has the edge. Difference number 2, bioavailability. Here's where things get interesting. Bioavailability means how much of the drug actually makes it into your bloodstream. Pregabalin is consistent. About 90% gets absorbed no matter what dose you take. Gabapentin is a different story. At lower doses, about 60% gets absorbed. But here's the catch. As you increase the dose, that number drops. At higher doses, only 33% gets absorbed. This creates what doctors call a ceiling effect. You can keep taking more gabapentin, but your body stops absorbing it efficiently. With Pregabalin, what you take is what you get, every single time. Difference number 3, dosing requirements. Let's talk about how much you actually need to take. Pregabalin typically ranges from 75 to 600 milligrams per day. You take it 2 to 3 times daily. Gabapentin needs much higher doses. We're talking 900 to 3600 milligrams per day, and you need to split it into 3 doses. There's a conversion ratio doctors use. 6 milligrams of gabapentin equals 1 milligram of pregabalin. That's a 6 to 1 ratio. What does this mean for you? More pills with gabapentin. More times per day you need to remember to take it. With pregabalin, fewer pills and simpler schedules. Difference number 4. FDA approved uses. Both drugs treat nerve pain, but their official approvals differ. Gabapentin is FDA approved for seizures, post-herpetic neuralgia, and restless leg syndrome. That's the shingles, nerve pain, and the leg movement disorder. Pregabalin covers all of those. But it goes further. It's also approved for fibromyalgia, for diabetic nerve pain, and for spinal cord injury pain. Why the difference? Pregabalin went through more clinical trials for more conditions. It proved itself in more areas. Does this mean gabapentin doesn't work for fibromyalgia? Not necessarily. Doctors prescribe it off-label, but Pregabalin has the official stamp of approval. Difference number 5, pain relief effectiveness. Now we're getting to the heart of it. Which one actually works better for pain? Studies show Pregabalin has 6 times higher binding affinity in your brain. That means it grabs onto pain receptors more effectively. Research comparing the two is clear. Pregabalin provides better pain reduction overall. Here's another key point. Gabapentin plateaus at 1800 milligrams per day. Going higher doesn't give you more relief. Pregabalin keeps improving up to 600 milligrams per day. It's more potent. It's more effective. Multiple studies confirm this. If maximum pain relief is your goal, Pregabalin typically wins. Difference number 6, side effects profile. Every medication has side effects. Let's compare. Both drugs cause dizziness and drowsiness. That's common ground, but Pregabalin has some specific issues. 11% of users experience weight gain. 38% report dizziness. Gabapentin brings different problems. 27% get headaches. It causes 3 times more nausea and vomiting than pregabalin. Some people get fever with gabapentin. So, which has fewer side effects overall? It's actually pretty balanced. Pregabalin hits harder with dizziness and weight gain. Gabapentin causes more stomach issues and headaches. Your personal tolerance will decide which feels better for you. Difference number 7, legal status and regulation. Here's something many people don't know. These drugs have different legal classifications. Pregabalin is a Schedule 5 controlled substance at the federal level. That's the lowest level of control, but it's still controlled. Gabapentin isn't federally controlled. However, 7 states have made it a controlled substance locally. Why is pregabalin more regulated? It has higher abuse potential. Some people misuse it for euphoric effects. This affects how you get prescriptions. Pregabalin prescriptions can't be called in as easily. Refills are more restricted. Gabapentin is easier to prescribe and refill. This doesn't mean pregabalin is dangerous. It just means there's more oversight. Difference number 8, cost considerations. Let's talk money. This is a big one for many people. Gabapentin has been generic for over 10 years. It's cheap. We're talking dollars for a month's supply in many cases. Pregabalin is about 3 times more expensive. Even as a generic, it costs more. Insurance companies know this. They often put pregabalin in higher tiers. That means higher copays for you. Some insurance requires you to try gabapentin first. They call it step therapy. Only if gabapentin fails will they cover pregabalin. When is the extra cost worth it? If gabapentin doesn't control your pain, if the side effects are unbearable, or if you need faster relief. Money matters, but so does quality of life. Difference number 9, titration and adjustment. Titration means slowly increasing your dose to find what works. Pregabalin can be titrated quickly, days to weeks in most cases. Your doctor can adjust it faster to find your sweet spot. Gabapentin requires patience. Titration takes weeks to months. Why? Because your body needs time to adapt at each level. Switching between these drugs is possible, but you can't just swap them overnight. Doctors taper one down while bringing the other up. Both drugs need dosage adjustments if you have kidney problems. Your kidneys clear these medications. If they're not working well, doses must be reduced. Never stop either drug suddenly. That can cause withdrawal symptoms and seizures. Let's recap what we've learned. Pregabalin works faster, absorbs better, and relieves pain more effectively. It needs lower doses and simpler schedules, but it costs more, has tighter regulations, and may cause more weight gain. Gabapentin is cheaper, easier to get, and has been around longer, but it needs higher doses, takes longer to work, and has that ceiling effect. Here's the truth. Neither drug is universally better. Your ideal choice depends on your specific pain type, your budget, your tolerance for side effects, and your lifestyle. The most important thing? Work closely with your doctor. They know your full medical picture. If you're taking either of these medications, talk to your doctor about what you learned today. Don't make changes on your own, and never share your prescriptions with others. What works for you might harm someone else. If you found this video helpful, give it a like. Subscribe for more clear medical information. Remember, this video is for educational purposes only. It's not personal medical advice. Your doctor is your best resource for treatment decisions. Thanks for watching. Stay informed, stay healthy.